reflection rather of the head. My favorite way to do it is actually standing up. I like that pressure on the occiput on that gallbladder 20 position. So when I stretch, I tell them I'm going to lift their head. Don't lift it for me. Let me lift it up. And I actually stand up and hold the head. I put my arms against my hips or my belly, and I just apply. All of the pressure is at the occiput. My hands are touching, but all of the pressure is underneath the ridge of the occiput. The trapezius and splenius cervicus and capitis and the erector spinae, so much stuff ties in right there. I think it's a wonderful area to get work. And the muscles on the scalp themselves, the occipital group attached. So I usually will hold it 20 or 30 seconds, and then I'll relax and slowly lay their head back down and do it again. Depending on if I'm doing some of the other ones we're going to do in just a minute, I may cycle, do that one, do some others, come back and do that one again. It's a really simple, easy stretch. Some people prefer to sit down and to get under and push up. As long as your back is straight and you can use your legs, that's fine. I've seen a lot of people who are getting underneath it like this, and it's horrible for your back. So as long as you're upright and you're in a good position, that's fine. Some people actually just like to set their head on your belly while they're doing this, help hold it up and make the arm work a little lighter. If you're comfortable with that and they're comfortable with that, go for it. Some people are, some people aren't. The other one you'll see commonly is to weave both of your arms under there and to come forward like this.
That's the one that I usually do.
Stable.
It is nice and stable. It's really broad pressure though. And so it is a different stretch. There's nothing wrong with it. I just like a lot of pressure right under the occiput. I like working that specific spot. But, it's not that I don't ever do the other one. I just personally like this one. So feel free to play with any or all of those variations. Just make sure you're in a good position with your body when you're doing it. Front blade or edge of the trap that gets most of the stretch. The way I like to do it is to push, because I like to be able to hug the edge of the table with my leg. If your table isn't too long and you can hook the other one, that's great as well. And I put one hand on the top of the head, and I want to move the head just in lateral flexion, right? I'm not rotating it. And I place my other palm on top of the deltoid here and the scapula, and then I'm using my whole body. My elbows are actually on my rib cage to separate that. And you want to keep an eye on them, make sure they're not, in pain or anything. It's just a decent stretch. Push in and hold. I like this because my arms aren't working that hard. My body is pushed forward. My leg is what's creating most of the pressure. And then I can gently relax. I never let people move their head. I never want them to activate the muscle I've just stretched instantaneously after the stretch. So I always bring their head back to neutral myself. Slide to this side and do the same thing. So I'm hooking the table, I'm putting her head slightly over so I can get in position on the corner of the head, on the trap, and I'm using my body to move in. She has way more movement on this side. That other side is not happy all of a sudden today. And with any stretching, you'll hear various numbers of how long you're supposed to hold them. 20 or 30 seconds is plenty. Some people say 7 is enough. Some people say it needs to be 60 seconds.
I don't want to count seconds, so I use breaths.
That works. That works. I just hold it until it feels like it's let go as much as it's going to. Everyone's been there, and you can feel them relax, and then they're not. And that could happen at different speeds for different people. So we did lateral, straight lateral movement for that trapezius. We're going to do a levator scapula stretch, where we're going to put the head in rotation, and then we're going to flex or laterally bend and flex in that same direction. Because the levator scapula comes off the superior corner of the scapula and comes up to the first through third spinous processes. So this is the best way we can get it lengthened. Right? Otherwise, the technique is exactly the same. I'm just placing my hand on the back side of the head and on the shoulder, and I'm going to be sliding her chin in front of her shoulder. Again, I'm trying to use my body, relax my arms as much as I can. Just stretch until it doesn't want to move. This is the one where if you ask them if it's too much, they have trouble telling you.
Feels great.
I figure if they start drooling, then you know something's...
Yeah, you're on the right track.
So it's pretty similar to the last one, except you rotated the head.
It's just position.
Yeah.
You'll find that changes what you stretch quite a bit. If the head is in a neutral position, you're just doing that ipsilateral lateral flexion, you don't get any of that levator scap isolation. If you rotate the neck, then you're isolating that levator scap a lot more. You still do stretch some of the trap, but it's way more focused on the levator scap, and that's what we're trying to do. See if you can do that with your head in position, so I don't feel like I'm doing as much pulling on the forehead. But if we're going to try to stretch the scalenes out, we're going to do a very similar thing, but instead of turning it away and pushing, we're going to be turning the head towards us. Right? Then we're going to be bringing the head backward, pressing onto the forehead, pressing onto the shoulder, bringing the head back like that.
How does that feel? That looks very awkward.
It's a strange feel.
Little exorcist looking.
It's a strange feel. It's really tough to get any stretch into that scalene area. And this is why I said I like to do this one prone more than supine. But it is worthwhile to try. See, some people can't turn their neck far enough to do it in a prone position, because you have to be able to turn your head all the way to one side in a prone position to do it. And depending on the person, you may only get this far. It may not be a lot of that rotation.
So you turn the head.
Will you do that one more demo one
Flip
more
the other side
time?
though, because I need to even out now.
Okay, so you turn it as far as
you
it'll
can.
comfortably go. Then you're going to move it into extension, and then you're going to be at this corner, and you're pushing the shoulder down and pushing the head back. The reason that I think it's kind of strange for me is it feels like I'm pulling her forehead up, like a facelift.
I
You
could
just
use
try to
that.
have to push it in as much as you can and not pull on the skin. You're not going to be doing it for hours at a time though. For a lot of people, it's a really useful stretch. And again, don't let them move their head. Bring their head back.
Oh, I was not gonna move. I felt like I might have broke something.
Very often what I say, trap stretch on both sides. I'll do the levator scap one we did next, and then I'll do this one on both sides. And then I always go back and do the forward trap one more time. That's kind of my flow of running through these. And I don't care that somebody only has pain or problems on this shoulder. I always stretch both sides. Just as a general film. It goes back to that idea of a washer attached to rubber bands. This is the washer. All of the shoulder go to the rubber bands. And if one is pulling tight on this side, it's affecting stuff on the other side. Try that with your partner.